Hi, everyone, and welcome back to Public Health Career Conversations. I am very happy to have with me today a colleague, also a public health medicine specialist, Dr. Amilcar Juggernath. Amilcar is a clinical advisor working at the Aurum Institute, and he has taken some time to take us through his journey in public health and what are some of the things that have influenced his decision-making, what the experience has been like, and hopefully some pearls of wisdom for all of you on who are thinking of pursuing public health as a career. So, Amilcar, thank you so much for joining us today. The first question I really have for you is taking you back to the beginnings of your public health journey. So I'd really like to know, what were some of the decisions you had to make? What sort of spurred your interest in public health? And how did you go about really, realizing or deciding that this was the career path for you?
Right, back in matric. No, I mean, I'm a public health medicine specialist, so my background is an undergrad of medicine. I guess when I got into that, I was interested in kind of a job where it will have some type of impact on people, positive, and health was a kind of obvious one. During my undergrad training, I think there was this feeling of, am I interested in treating sick people, or am I actually interested in seeing people healthy? And that kind of manifested over time. We did have a public health lecture where the specialist told us that the Minister of Finance saves more people in the country than all the doctors in the country put together. And I just sat there like, wow. Yeah, so I mean, I did enjoy the undergrad medicine. I did enjoy working as a clinical doctor seeing patients, but there was always this nagging feeling of, I feel like my space is not here. I need to be in a space where there's a higher impact. So instead of kind of spending those 3 hours in a theater on a complex surgical case, I would prefer if I could, maybe spend a week working on a project that can affect a couple of thousand people. And I believe public health does have the power to do that. And I think that is a space I like to see myself in. Going through undergrad, I think our public health lectures were particularly boring, and I never thought I'd ever want to get into something like this. But I think I was exposed in different ways from different people about the space and the idea of population health, and how someone like me can get involved in that. And it definitely played the role in kind of pushing me in this direction. And then, it's the things like the prevention, it's the large number of people impact, it's the sustainable differences you can make to improve health and keep people healthy that I'm quite interested and keen to see going forward in career.
Okay, great. So that's very interesting. Someone who's from the beginning of the sort of medical career had an idea. And I say this only because I'm sure you've had this experience as well, is that in undergrad curriculums, public health is but a small part of our training. And in many ways, because of that, it's not seen as vital for a lot of medical students. Some of the more, clinical specialties obviously take precedence in our training. And so people don't really, I think, A, understand the value, or B, even understand how it connects to clinical medicine. So as you say, it's sort of not done justice in the undergraduate curriculum. And I think, as I'm sure you probably will agree, that if we are going to get better population health, we actually need to flip that system where our training is not spent on tertiary care and really helps people understand population health and primary health care, which is another aspect of training that is sort of overlooked. So yeah, that's very interesting that you were paying attention enough in undergrad to know that, this is a potentially interesting avenue to.
this is more in retrospect. Back in the day, I don't think I would have been able to vocalize, oh, this is public health, this is what I like, this is what I'm interested in, I want to do it. It was more kind of, this information coming in. It's like, stringing on some chord up there, which only made sense to me later. So when it was time to look for something to do post-grad, then it eventually kind of consolidated into this. Public health is the thing.
Yeah, and to that point, I mean, it's sometimes not very, even if you were paying attention, it's not sometimes easy to connect the dots as to how this applies sort of to the clinical world. So, and we'll get to that now because I see you are a clinical advisor. So that sounds like you are bridging that gap really well between clinical medicine and public health. But before we get there, I think maybe walk me through what the public health then journey was. When did you decide to actually formally start studying towards public health? And then what did you pursue when you decided to do that?
So I think I joined the program fairly early in terms of a registrar. So I went through my internship in ComServe. I worked for about 9 months as a medical officer, and then a reg post popped up. So I was able to apply for that, got the position, and entered the public health world. I think at the time, I don't think I fully understood what a public health medicine specialist specifically was, but it was, I mean, I looked at the modules. I think I spoke to 1 or 2 people, and the ideas were there that were typically of interest to me. I guess I was still young and naive because I didn't think to question, what's the working life like? What are you going to do when you're done with this 4-year program? It was a bit beyond the future that I could see. So, I went into it a little bit blindly. But I don't regret it because I think the work that I am doing is of interest. And I think there's always that idea of the impact that it can and is going to have. So that kind of keeps me going. In terms of the work, shall I run through the positions I've held over time?
Yeah, that would be great.
Yeah, so I think our REG program at BITS and the Gauteng Department of Health does kind of throw us around into different types of public health spaces. So we went through the district health offices in Johannesburg and Ekurhuleni. We went through the central hospitals, Charlotte Maxeke and Chris Hani Barra. Then we went to the National Institute of Occupational Health and the NICD for common diseases. And then I was lucky enough to be placed in the National Department of Health for a 6-month rotation. We were placed in the NHI branch, and that's kind of the talk of the day in the health system space of public health. So to me, it was kind of being involved in creating a new health system or trying to impact major reforms to the health system. And if I think about it from an impact perspective, that's always obviously a huge deal, and something I would like to have a major input into, because I think the impact that would have on population health will be huge. So when I was done with my reg time, I wanted to stay behind in the national department, and I think I did find some niche work which kind of made me able to do certain work that was needed in the department. And so I was able to get a contract with an NGO to be seconded to the National Department of Health to continue the work that I started with in my reg time, but then also to build on that towards other NHI related work. So I was there for a year and a half, a year after my reg time finished. And then I recently joined the Aurum Institute as a clinical advisor. So I think in the NHI space, it was a lot of understanding policy, building relationships with people who are going to implement the policy, and then a lot of kind of technical public health stuff related to health systems, related to management, related to health financing. Obviously, with the background of research knowledge, policy analysis, epidemiology, and things like that. And so entering this new space, it is a huge change. And what I do here is pretty much, I guess there's clinical parts to our project, which need to be supervised. So I assist with things like understanding and training on the clinical protocols. I think we have one of our projects, which is, I won't give too much away, but it's a project that requires patients to be screened through. And, I entered this and I thought, everything was sorted out, but then I realized, wait, there's actually no protocols for all of this. Someone hasn't thought about the whole of the patient flow, the referral out, and the linkage to care. And that stuff, that's second nature to me, but it wasn't second nature to the project team. So they hadn't figured that stuff out. And, that's something I need to work on, which is great because that's stuff I do like, to understand the program and kind of develop a practical way for us to implement it, a way that has the highest impact that it can. Yeah, I think that's my public health space. I think outside of work, I've been involved with PASA, the Public Health Association of South Africa. So there was an opportunity to join the board, and I did. And it's a nice space to, I guess, network with other public health practitioners, understand some of the things around, well, conference management, but then also the types of, that conference management. But the types of work you can do outside of a workplace in public health. That was a nice place to try to understand that and input into the public health space. And then recently, I've been involved with the University of Pretoria's Department of Public Health Medicine. They're joined with Steve Biko Academic Hospital with some of their teaching work, some of their academic work, which has also been quite interesting. I think on that, and touching to one of the things you said earlier, they actually have a public health internship rotation. So while we don't have much kind of engagement with public health as an undergrad, they do have the opportunity to, it's mandatory for interns to rotate through that department and kind of understand it on a very practical level of what public health entails.
That's great. So yeah, I think I'll pick up on the last point. It's great that they do have interns, and I think one of the conversations that was, one of the threads of conversation that's been coming out quite often is that people want to go into public health, and you said yourself that you didn't really know what you were getting into. And so I think having that exposure in internship is really great, because you have an idea then whether it's something you could do on a daily basis, and then decide whether or not you want to go pursue the skills and the knowledge to do that.
Yeah.
I mean, otherwise you may find yourself pursuing a whole degree and then realizing that it's not not what you envisioned. Having said that, though, I think, some of the skills that you learn in public health training, so analyzing data, decision making, all of that will assist you clinically as well, or if you're running a practice, to be able to make better decisions. So it's not all lost. I think it augments your clinical knowledge as well. But yeah, so it's very interesting, I think, to see how you've journeyed through. I mean, obviously you had to undergo those various aspects of training. And another reflection that's been coming out quite a bit in these interviews is that public health training is so broad. We do, as you can see in those rotations, you're doing epi and biostats, and then you're at the Institute for Occupational Health, and then you are, doing outbreak response. And what is really interesting, speaking to you and to other colleagues, is that no matter where we are all always pulling on different aspects of public health training. So you'll be doing data analysis, and then having a policy discussion, or writing a guideline or a protocol, which is really great, because then that gives you variety, but also allows you to, I think, work holistically. So you're not, even if you're doing policy development, you still have to, have quite a sense of all of the other areas, or pull on data, etc., to be able to make that, develop that policy. So it's very interesting that this keeps coming up. So in all of our discussions. So I think that's an interesting thread. I think the question that a lot of people, then you said now that you didn't really know what you were getting into. What does your day look like? Like, what exactly are you doing on a day-to-day basis?
I come to work and I say hello to people. Let's see. So at the moment, I guess I'm involved in a specific project. So we have specific things that we need to achieve, and it's kind of figuring out, what are the best ways with my knowledge that I can kind of plan and create in a way so that we achieve those goals as a project as a whole. So it's some strategic things like that, where this is the outcome, this is how I think we can get into that. So it's a lot of reading, a lot of thinking, a lot of chatting to people and planning. There's a supervisory part, so people asking me questions that they think I know about and know how to answer. I guess without training, it's easy to kind of grasp things and be able to explain it to the people you need to, because that's some of public health is about that. So the supervisory part. I mean, practically, we are the beginning of our project, so it's trying to develop the protocols, develop the systems and processes. It's doing baseline assessments in a way that you can use the information to analyze and develop your gap analysis, develop your interventions to try to improve those gaps in our current system. So that's kind of the stuff that we're doing, or I'm doing on the day-to-day. Couple of meetings here and there, but lots of reading, lots of interaction, lots of, on that drive home, there's a lot of thinking about what happened in the day, and, kind of refining some of the thoughts that went through your head during the day. I think that's my work day at the moment. Yeah.
Great.
Yeah. I think throughout my working career, there's been times where there's been a lot of working from home, which was great. At the moment, I am coming to the office on most days, which has its perks, but driving is tiring. But yeah, I think with public health, there is that option that you don't have to be on site all the time, but there's definitely benefit to you, the project, and the team to be on site, to be physically present and involved in what's going on, rather than, I guess, trying to figure out and command things from your ivory tower or your union buildings, as we say. Yeah.
That's a very good point, because I think what may not come out easily or may not come out strongly sometimes, is that public health is very much a team-based approach. So we work a lot with other people, other clinicians or technical people, other public health specialists, and so there's a lot of discussion and deciding what to do, and so you have to be geared to be able to work with other people in that way. Of course you can. I mean, there's sometimes projects or something that you're doing that you do alone. You sit and you write a paper or a document, whatever it is, that you do that alone. But there's a lot of team-based work and opportunity for discussion, and you're not really alone when you are doing the work that you do. Yeah.
As you said, that someone came in because we never work alone. No, I 100% agree with that. And, there's a lot that you can do on your own, but there is a limit to the capacity of what we can kind of imagine is actually happening out there. And sometimes, we learn over and over again that you have to understand the context. And a lot of the time, probably because of our medical training and the way we practice, we feel like we understand all the context because we've worked in the worst of the worst. But yeah, it's still never fails to surprise me when you go somewhere and you realize how different the context is, and how you knew it was there, but you understand it differently when you're there. Like, I know that we have informal settlements, but when we went to an informal settlement with our community health workers to see a TB contact and assess them, it was just like, oh, right, this is what an informal settlement is like. This is, how can we ask this patient to do these things when this is their surrounding? It just gives that extra understanding that you need, and we shouldn't take for granted. I mean, yeah, because we know it's there. We have some idea of what it's like. Maybe a couple of years ago, we went to a place like that, but we go there again, and we're human. It renews that kind of sense of feeling that you need to remind you what context can be like.
Yeah. And similarly, we tend to, in our careers, gravitate towards certain things because they front of mind for us. We're working on them all the time. And so you also need different people to be basically saying, so, well, but what about this? So yes, you're talking about, this community or this disease burden. What about these, this set of patients, or this population, so that, nothing is sort of left behind completely. There's always people with these different viewpoints and seeing the different aspects of public health who kind of remind you that, there's other layers to it. And so I think that is a real value in sort of the team-based approach that public health takes, is that you're not sort of siloed and blinkered in your approaches.
Yeah, and we're not experts at everything, and we don't have to be. We just need to be aware of what's out there so we can tap into it and get that expertise out of the right people. Yeah.
And then the field is so broad. I mean, there was a discussion the other day at one of the webinars around, do we as public health specialists feel like, we are different than other public health practitioners? And I think the point really is that there's so much to do. There's really space for everyone, and everyone brings something unique to the table, their own experiences. I mean, as you say, we know a lot of what's happening in public health, but we haven't worked in every single community or in every different level of the health system. And so you do need different people who've been steeped in different contexts to bring that lens and be like, well, no, this is actually different to my experience, and so that you can muddle through and some sort of, common ground around it. So that's probably a nice way of saying that we probably fight a lot also.
Of course. We don't put it like that.
we fight for things together, I think sometimes. So we all kind of fighting for the common good, but with different viewpoints. So it's not we're not fighting each other at the end of the day. So yeah, before I get to my last question, I think I just also want to pick up on your point around, the lecturing and, being on PASA as well. And I think that's another aspect of public health. There's a lot of sort of what I call academic citizenship. A lot of people involved in public health are involved in organizations or advocacy or training of public health, other public health specialists or practitioners. And so, again, this allows you to be involved in things beyond just your 9 to 5.
Yeah, and that definitely, if work gets boring, that's definitely a nice reminder of why you're in the field, and it gives you that extra to keep going. And yeah.
Okay, great. So my last question is basically more of a reflection question, sort of, if you were to think back to yourself, when you were starting this journey, for people who are at that point in their careers, who are sort of weighing up public health as a potential option, what advice would you give them as they are thinking through, the next steps in their career journey?
I think, look at what goal you're trying to get out of your career. And I think with me, it was kind of trying to reach that high impact of improving health. And that's why I felt this fit. There are other goals that will lead you to this path. I don't think I know them all, but I think that should be your main motivator. I know I speak to a lot of people, particularly, doctors, because that is my field, and they they talk to you about how they're grappling with this clinical work because they're thinking about things like prevention and systemic change. And those are the people I'm like, yes, maybe consider public health or family medicine if you still want to see patients, but have that understanding of population and community health. And then there's those others who are like, oh, I can't stand seeing patients. I just want to get into management or something. And I'm like, I don't think public health's for you then. You can't get into this because you don't like seeing patients or you don't like the clinical stuff. It should be because of another positive that you're aiming towards, like a different type of goal. And yeah, I think, yeah, those are the little bits of advice. I think it's a space, if you hear about it, then ask people who work in it about it, so that you do get a better understanding and understand if that is really what you want to do, because the type of work that we do is definitely different from what another type of healthcare worker would do. And you need to accept that is going to be a change, and you need to have a reason for why that change is good for you. And yeah, that would link back to the goal of why you're getting into this. Yeah, wow, it's a nice and interesting space, and I think it's a hugely broad space. So if you do have some confusion that you really want to have that high impact on health, but you're not sure if you really like the disease outbreak stuff, or you want to be a national government making policy, or you want to be at a computer analyzing data with biostats, you can do any of them. You can go into social stuff, you can go into disease specific stuff for different types of populations, and I think it'll be good to speak to multiple people involved in public health so you get a proper understanding of what the options are, so that you can kind of branch out into where your space is. But yeah, we need more public health people, so come. But come with the right reasons. This is not the place where you can make easy money. This is not the place where you're going to, yes, maybe you won't work night shift, but you will still open your laptop at night. So the work is different, but it's still hard. You don't have, the people you deal with are still people, so you're going to have frustrations with people in the office and in management. It's got its things like other jobs do. So I find that reason that's actually public health related to push you towards our field.
That's some very good advice. I think especially the last bit's very practical, because I think one thing you learn is all organizations are the same, regardless of
different but
the same. So you will deal with the same stuff. And like you say, you may not have a 9 to 5, or you may not do overtime, but you don't hand over a patient. Your work follows you in public health. So yeah, you have to be aware that that's not clean cut, sort of ending my day now. But that doesn't mean that you can't make some really good lifestyle choices for yourself to make sure that you handle your workload in a way that is beneficial for you. And I think it's a good point around making the conscious choice into public health as opposed to sort of like defaulting into it. I think what my personal reflection is, a lot of what you do when you're training. So when we did internship, it's easy to know what you don't want to do. It's easy to know, like, I don't want to be an orthopedic surgeon.
Exactly what I was thinking.
Yeah. But it's less easy to know exactly what you do want to do. And so I think it's a good point to take the time to reflect and think through, if you were to go into public health, why would you do that, and what would it mean for you? I know lots of people may not have access to people who are in public health to be able to have these discussions with them. That's partly the impetus for this, is so that somebody can watch a whole bunch of videos and maybe get a better sense from this around what public health may potentially entail, because like we say, in some ways it's shrouded in mystery. I remember a colleague, not a colleague, but a friend of mine once said to me, he's like, I know you perform magic every day, but what do you actually do? And so, yeah, I think,
Right.
you know, but even to, I think other colleagues sometimes who are in public health, we don't really know what each other does on a, if you explained it to me, I'd understand, but like we all have such varying roles that it can differ quite, quite a bit.
Sorry. But yeah, if I was in undergrad and watching this video and you started saying the term reflect so much, I would have switched this video off. So if your audience has lasted this long, public health's not as fluffy as it was in undergrad or as it is when you read it. It's proper sciencey stuff, and you can really make it demystify it into a real thing that has real impact, which I think I was struggling with when I started studying in public health postgrad. Because at times I was like, oh shit, did I get into this space which isn't like it's just fluff. But over time you realize actually no, there's method to this fluff. And yes, there's a human aspect, so there has to be some fluff, but actually it's real stuff that can make real impacts. So yeah.
And I think that was a really good point about the fact that public health can seem sort of esoteric when actually it is quite steeped in science. I mean, on the one end of the spectrum, we have biostats and epidemiology, which is obviously mathematics based, and then we have some parts of public health which require a lot more discussion and deliberation. But again, this is all within frameworks, within robust methodology, and so it's not all just pulled out of yes, exactly. Which it may seem like when you're working on the ground and you're wondering how decisions are made, but yeah, rest assured they are made with some sound technical expertise behind them. So thank you, Amilcar. I think this was really great. Any sort of parting words, unless you want to disappear again in a poof of smoke? But
That happens.
the last words for people who are watching.
Wow, public health is cool, guys. Join us, but for the right reasons.
That is the tagline. Join us for the right reasons. But yes, thank you so much, Amilcar. I really appreciate you taking the time to be with us today and unpack and reflect on your journey. I think there's some valuable information in your journey, not just from what you've said directly in terms of advice, but just in helping others see how you've navigated the space and these decisions. And I hope that it will inspire people to take up public health, or if not, at least give them some idea of the why not, why public health may not be for them, because that's the other side of the coin as well. So thank you so much again. I hope that your work, and I'm sure it will, your work at Aurum proves to be exciting and fruitful, and looking forward to seeing what you do next.
Cool. Thanks, Satya. And thanks, everyone.